Hello and welcome to the Beef Edge, the Teagasc Beef Podcast, for all your latest news, information and advice for Irish beef farmers. I'm Catherine Egan, and on this week's episode, as part of the Department of Agriculture, Food and Marine Animal Health Awareness Week, set to take place in conjunction with the World Antimicrobial Awareness Week from the 18th of November to the 24th, I'm joined by Superintending Veterinary Inspectors Damien, Barrett and Caroline Garvan. Caroline, this year's event focuses on antimicrobial resistance. What is antimicrobial resistance?
So, Catherine, when we talk about antimicrobial resistance, we really mean antibiotic resistance. What we mean is that when you use antibiotics in your animals, they no longer work. And we'd be quite familiar with it, I suppose, on the human health side, because it really is first and foremost a human health issue. We'll all know of people maybe that have gone into hospital and they've ended up staying a lot longer than they thought because the first line of treatment didn't work. So really what has happened is, and this was known about, I suppose, when penicillin was first discovered by Alexander Fleming, that the more you use an antibiotic, the bacteria want to survive. They've survived for thousands of years. So they mutate, they change so that the antibiotic doesn't work. And so what it means is our disease treatment options are becoming more and more limited. And this obviously is of huge concern. We've seen it now with COVID, how important it is to have effective disease treatments. So what we're seeing now, particularly in human health, is there are some diseases in certain parts of the world where there is no treatment because antibiotics have been overused and in some cases misused. So it's the overuse and the continued use of antibiotics not continuing to work as they used to.
And Damien, what is the objective of Animal Health Awareness Week?
Catherine, the objective of Animal Health Awareness Week is to basically raise awareness among the farming community of the importance of good animal health. This initiative came about through a review of our early warning surveillance system, where it was recognised that awareness among the farming community of what normal health was, what normal disease levels was very important in detecting the incursion of a new or emerging disease. While it may be while a new or emerging disease may cause the headlines, it's actually endemic disease, those diseases that are occurring on a day-to-day basis at farm level that probably have the greatest economic impact on farming. So this initiative came about in a way to address both those issues, raise awareness of the importance of preparedness for emerging diseases, but also raise awareness of the potential losses that poor animal health can give rise to at individual farm level.
And Caroline, I suppose this week coincides with the World Antimicrobial Awareness Week. What's the objective of the World Antimicrobial Week?
The objective, Catherine, is to raise awareness so that people understand, firstly, what AMR is, why it is important to address AMR. So in other words, why it is important to look at how we use antibiotics in our animals and also in ourselves, and to try and reduce the level of use and to only use them when absolutely necessary. And I suppose this has been a global initiative for the last number of years, but there has always been an event every year on the 18th of November because it's European Antibiotic Awareness Day. So it's very much been a European focus that everyone understands why we should look at antibiotics differently. And I suppose it's intricately linked to animal health or human health because healthy animals don't need antibiotics. And so that's why ourselves in the AMR side came together with Damien's division and saw it as a really nice, synchronicity of promoting animal health and also promoting awareness that when you've healthy animals, you don't need to use antibiotics. The whole thing about disease prevention and I suppose promoting alternatives to antibiotics, so increased use of vaccination and other tools. So it's really about sharing knowledge, and I suppose we're all the same. If we don't understand something, why would we change our behaviour? And so this is where we're coming from on the awareness raising issue.
That's great, Caroline. And Damien, you mentioned there the importance of animal health. Why is good animal health important for farmers?
Well, animal health and animal welfare are inextricably linked, but animal health and economic performance are also inextricably linked. And if I think we're all reaching in this era of sustainability and of climate change, and all this talk about greenhouse gases emanating from ruminants. Basically, efficient farm production is both, our livestock production is both good from a profit point of view and a sustainability point of view. If there's anything that's going to reduce the average daily gains of cattle, be that as weanlings, as finishing cattle, that's going to delay the sale of those animals, and it's going to, or else they're going to be sold at underweight. And that's if animals are going to be turned around at, say, up or finished within the 30 months, or as we're speaking about or hearing about recently, that may be there may be encouragements to get people to finish them at lesser ages, that they're going to have to be working as efficiently as possible. And animal health is one potential drag, as I think one of our colleagues says, genetics creates the potential, management realizes that potential, but disease destroys that potential in animals reaching the productive targets. So in essence, good health is important for good productivity and production efficiency.
I suppose, Damien, from a national point of view, why does the animal health beef status matter so much?
From a national point of view, it's very important when we're going out to both European partners and particularly with third countries. The requirements of certification, third country certification, are quite important, and there's quite a list of diseases that these trade partners want declarations of freedom from. Thankfully, as an island nation on the periphery of Europe, that makes biosecurity, national biosecurity, that little bit easier. But we cannot become complacent, and if we are going to access these markets, like there in 2000, there this year, earlier this year, Ireland retained BSE negligible risk status, and for any, thankfully for most farmers, BSE is a memory. However, it's not a memory among our trade partners, and when they come here to view our systems, our assurance systems, there are a lot of questions on how our system for the control and eradication and prevention of BSE works, and it's particularly so among the Asian countries. So basically, the customer is king in this instances, and they need those assurances, and we're delighted to be in a position that we can offer those assurances to these potential markets.
Definitely, Damien. And Caroline, I suppose you mentioned there the importance of antimicrobial use and how farmers can be responsible. How can we help prevent AMR, or what strategies can farmers use to be more responsible around antimicrobial use?
Okay, well, there's a number of strategies, and I might just reference, we have a committee that an animal health implementation committee, which delivers key actions around addressing AMR. It was developed in 2018 when we launched our first national action plan to address AMR, and we're actually launching our second one on the 18th of November. But that group developed a number of policy documents, codes of practice around responsible use of antimicrobials. And one of the codes is specific to the suckler and beef farm sector. And so those codes are on gov.ie. If you go to gov.ie, AMR, you'll get that code of practice. And it just was developed jointly between the IFA and Teagasc and Veterinary Ireland. And there's some really nice, reference tools. So it references a lot around weanling pneumonia. And I suppose the thing is, when there's a weanling coughing, you have a lot of differential diagnosis. So you should not be jumping in with a bottle of antibiotic, because you don't know, is it bacterial, is it viral, or is it lungworm? And if you have a viral disease, the antibiotic will do nothing for it. And it's a waste of money, and you're not adding to reduce the disease spread. So it's having that awareness, and I suppose this is where, you know, veterinary expertise comes into it, in developing a herd health plan, so that you know what are the common diseases on your farm, and when do you need to treat, when do you need to vaccinate for whatever viral diseases you have, when do you need to treat for parasites in particular, say for lungworm, your grazing strategy. There are a lot of tools, and really it's all built into having a herd health plan, and using whatever treatments only when necessary. So I would really recommend if farmers could have a look at that guide. It does give some nice tools about, I suppose, improving biosecurity, how to look after your newborn calves, your weanlings. Just covers a few areas and gives some nice tips. But really it's all about enhancing your biosecurity, you know, looking at how you can improve your husbandry, strategic use of vaccination, and only using antibiotics on foot of veterinary advice. So, you know, it's all about disease prevention. And I think if if farmers could, you know, come together with their vet, develop a herd health plan, and it really, as Damien says, down the road, it is going to improve your profitability. And in terms of sustainability, there is a huge focus on the farming sector and their use of antibiotics, and in particular certain antibiotics, which are drugs of last resort in human health. And these are called highest priority, critically important antibiotics. But I've seen it myself. One of my children was very, very sick with a kidney infection, and she had to go into hospital, and she was only 10 and a healthy child. And when we looked at the antibiotics she was getting, and they weren't working, and the consultant came back and said, look, there's 10 antibiotics available to treat this, but only one of them would work in your daughter because she's resistant to all the other 9. So that's the reality. And that antibiotic that she needed, I had used in calves and in weanlings for different conditions. And so, you know, that's just to bring home the importance of how we all have a responsibility, we all have a role to play. And the one other point I might reference, Catherine, is sometimes there's a confusion between antibiotic or AMR and antibiotic resistance and AMR, or residues, antibiotic residues. And people think, well, I'm well outside the withdrawal period, I won't have residues. Yes, you won't have residues, but you could still have resistant bacteria developing in the animal, because, as I said earlier, any use of antibiotics will drive resistance. So really the message is to protect your animals, but also to protect your family and your community, you look to reduce your use of antibiotics.
And I suppose, Caroline, that's something we're going to see in the new year with legislation changes being introduced in January. What impact will this legislation have on beef farms?
It will have quite a significant impact, Catherine, because this new legislation, it's the new veterinary medicines legislation, and it's the newest piece of legislation in terms of veterinary medicines, because there's been nothing new for the last 20 years. And in that 20-year period, there's been a continuous increase in the level of antibiotic, or AMR, antimicrobial resistance. And so this legislation is looking to promote responsible use of antimicrobials. And how it's doing that is, I suppose, that there's very much a prohibition on preventative use of antibiotics, prophylactic treatment they call it, except in exceptional circumstances and only for individual animals. So, you know, the old practice perhaps of buying in a group of weanlings and giving them all a shot of long-acting antibiotic, that's no longer acceptable unless there's a severe risk of disease and your vet has determined that it's necessary to use these. So there's no more routine blanket treatment with antibiotics. The quantity that your vet will prescribe should only be enough to treat the disease present on the farm. Very small quantities of antibiotics prescribed at any one time. So really what it's doing is it's looking to reduce the use of antibiotics on farm and promote better disease prevention and management strategies. The other thing to mention is there will be a list of antibiotics that cannot be used in animal health because they are deemed so important in human health. And so, you know, we need to protect animal health and welfare absolutely as well. So we want to ensure that we don't lose the opportunity to use certain antibiotics in animals. And so there is an important role that we're not seen to overuse some of these drugs of last resort. And again, this group I referred to earlier on the AMR side within the department with all the stakeholders has developed a guidance on why you shouldn't use certain antibiotics. So unless the vet prescribes, the farmer can't use. But I suppose the bottom line is the legislation will control and reduce the use of antibiotics. So I suppose beef farmers can expect that there won't be the same, I don't know if the right word, availability, but vets will be prescribing in a different way, perhaps.
Thanks very much, Caroline. And Damien, have you an opinion on what are the challenges from a health and AMR perspective going forward for beef farmers?
I was looking at those kind in the very short term, and in the maybe possibly longer term. But I think one thing at this time of year that beef farmers is be worth them looking into is the whole issue of liver fluke infestation and how it affects performance. Typically, you're looking at the buildup of parasites over the grazing period, and especially when we get wet weather. And I was just looking at some work that a colleague of ours, Rebecca Carroll, did a couple of years ago, looking at the impact of fluke infestation on performance. Basically, there was a 40 to 50 kilogram reduction in carcass weight among animals that had a history of fluke infestation, and like that's you can count the immediate loss in that context. But other work from Scotland has shown that there's the finishing periods could be increased by up to 50 days through fluke infestation. So I think that's something in the short term that's a challenge that might seem mundane, but if you're looking at a reduction in carcass weight of up to 50 kilos and increased finishing times up to 50 days, that's quite a substantial economic loss. I suppose from a beef farming point of view, in terms of exotic diseases, which is the other the twin track of the animal health awareness of this, we need to be aware of the issue of blue tongue in particular, and it's going to be focused on in one of our webinars for Animal Health Awareness Week. Blue tongue is a midge-borne disease, and it's present in parts of the continent at the moment. Midges can be blown up to 400 kilometers by if the wind comes at the right direction at the wrong time, if you know what I mean. However, it's more than likely that this disease will be walked in through the importation of pedigree breeding stock from the continent. And this is something that I think if anyone is going to be importing livestock from the continent, they should be aware of it, and take the necessary precautions, and for instance making sure that the importation occurs during the inactive midge season. The worry about blue tongue, the clinical disease is one side of it, but the more important worry possibly is that it's one of these diseases that's very important from our national herd health status for trading purposes. And essentially, if there were to be an outbreak of blue tongue in circulation, there would be a restriction zone of 150 kilometers within where that outbreak took place, which essentially means that most live exports from the country would come to a halt in the event of such an outbreak until that was taken under control. So I don't want to be putting the frighteners on people in a way, but at the same time I want them to be aware that this is a threat, and it's something to take precautions about.
What precautions can be taken, Damien, to avoid this happening?
Well, I think that one of the main things, as I said, is to ensure that they're imported during the inactive midge season. The real fear here is that the blue tongue virus will get into the native midge population, and if it got into the native population, it would spread all over the country. So make sure that the importation occurs, say, in practical terms, from sometime between December and February. Other things would be to ensure that these animals get properly treated with a parasiticide, an external parasiticide, and also to ensure that they're properly vaccinated and certified to be vaccinated from the departing member state.
Caroline, over the course of the week for Animal Health Week, there will be a number of webinars taking place. Can you tell me more about them?
Okay, so thanks, Catherine. Yeah, this is a joint event to promote AMR and animal health. So we have 4 webinars going out. The first one on November the 18th. And this one is specifically focusing on antimicrobial resistance because it is European Antimicrobial Resistance Awareness Day. So as part of that webinar, we have different speakers covering different elements. As I've said earlier, AMR is first and foremost a human health issue that also impacts on animal health. So we're covering AMR from a One Health perspective. So we have a consultant from NUIG and a GP from Cork, both talking about AMR in the context of human health, the concerns and challenges that they face. And then we have a case study from a pig farmer who has successfully managed to reduce antibiotic use on his farm. And I suppose beef farmers might say, well, what's the relevance to me? I suppose the relevance is that the strategies that he employed, apply across the board. And really what he did was he replaced antibiotics with vaccines. And he said that he now has, he is more profitable, his workload is less, and it's just a really positive story. Biosecurity was really key as well in how he changed his farm management practices. So he'll be speaking with his vet on what he did. And then we have a speaker from the UK who's a veterinary speaker who will talk about the whole One Health issue and how they're approaching it in the UK.
The second day, the focus is going to be on One Health and particularly on zoonotic disease. One Health is this concept that the health of the environment, animals and humans are all intertwined. And the focus, as I said, on the second day, November 22nd, is on zoonotic diseases, diseases that are acquired from animals and transferred to people. That's day 2. Caroline, do you want to talk about day 3?
Yeah, thanks, Damien. So this is November 23rd, and the focus on this webinar is all about herd health and just highlighting the importance of proactive herd health planning in maximising health and minimising your antimicrobial usage. And then our last speaker, and Damien's already referenced some of this, the whole area of parasitic challenges at farm level, and in particular, I suppose, anti-parasitic resistance. And I mean, something I should have mentioned under the new legislation is that tying in with the implementation of the new legislation is that all antiparasitics, so anthelmintics, any of your porons, everything will be prescription only from the 28th of January. And I'm sure farmers may have some concerns about this, but really they've moved to being prescription only, so you can only purchase them on foot of a prescription from your vet because there's a continual development and spread of anti-parasitic resistance in Ireland. The evidence is there, and because of that, they have moved from being for sale over the counter to prescription only. But James will just talk about the challenges that are out there at farm level in terms of treating parasites.
Our 4th and final day is November the 24th, and this will be about emerging disease threats. And the topics to be covered are foot and mouth disease, blue tongue. We're going to have a case study on low path avian influenza. We're going to have someone speaking about the importance of having antimicrobials available for immunocompromised patients in the human health sphere. We're going to hear from our colleagues in UCD on the role that veterinary epidemiologists had in the NEFIT modelling for COVID, and we're going to hear from our colleagues in the north from DERA on African preparedness for African swine fever.
Thanks very much, Damien and Caroline, and we look forward to tuning into all the different webinars this week. The links will be included in the podcast text.
Thanks very much, Catherine.
Thank you, Catherine.
That's all for this week's episode, and my thanks to Caroline and Damien for joining me on the show. You can catch up on all other shows and interviews from the Beef Edge podcast on the Teagasc website at teagasc.ie, or you can listen on Apple and Google Podcasts as well as Spotify. Don't forget to rate, review and subscribe so you never miss a show. For all other updates from our beef programme, keep an eye on our Twitter and Facebook pages. Until next time, I'm Catherine Egan, and thanks for listening.